My name is Melody Lambert. My diagnosis was avascular necrosis of the right hip. What I noticed most, the effects of my hip pain, what I noticed most was having problems with working. And what I do, I'm a registered nurse and I'm a liaison for a home health company, which means I travel quite a bit in my area and I see patients all day long in several different hospitals. So I drive and I'm in and out of the car, do a lot of walking in and out of facilities. And so what I really noticed first off was that I was having a lot of pain getting in and out of my car. That rapidly progressed to a lot of pain while I was walking, a lot of pain even while I was sitting, and progressed even to pain while I was sleeping and trying to rest. And that's when I knew that I had to get something diagnosed. I knew that something was terribly wrong. We weren't able to do a lot of the things that we had customarily done pretty routinely. We loved to travel, we loved to play golf, we loved to hike, and all those things were shelved for the time that I was in all that pain before my surgery. After giving it a lot of thought and researching the physicians and the hospitals in my area, it didn't compare to what I was able to get here at Steadman Hawkins and with Dr. Burnikel. Dr. Burnikel did 2 hip replacements for me, one on each side. On the right side, I have a Birmingham hip. 2 years later, I had a total hip replacement on the left. For the first surgery, I knew that I was coming here and seeing Dr. Burnikel was going to involve quite a distance and travel, and the commute is about 5.5 hours from where I live. But after meeting him and going through the first surgery, I felt it was so worth it. All that traveling that I had done to do the surgery here was absolutely worth every minute of travel that I spent. When my left hip started to give me problems and I knew I was facing surgery again, I didn't even consider staying anywhere around my area. I knew from day one that if I had to have my hip taken care of, that I would do it here again. Because of the comfort level I felt with Dr. Burnikel, his staff, with the hospital, just with how beautifully everything went. The facilities here at Steadman Hawkins, the facilities at Patewood. I mean, the hospital's like a hotel. The rooms are beautiful. My husband was able to stay with me. That's not anything that you see in my local area. After the first hip replacement, I was impressed how quickly I got better and stronger, and I was able to start participating in activities again. My first surgery was done on June 1st of 2009. One of my big goals for getting better, and one of the reasons I scheduled it in June, was because my oldest son, was getting married in August. And my big goal for that wedding was to be able to dance at that wedding. I know that sounds silly, but that was a big goal of mine. It was a beautiful, beautiful ceremony. It was in Raleigh, North Carolina, and beautiful reception. And I was able to dance at my son's wedding, and it was the mother-son dance, and it was wonderful and beautiful, and it was very, very scary because at the end, he decided he was going to dip me. Even though I whispered in his ear, "Please don't do that." And he said, "You're gonna be fine, Mom. I've got you." And so it was great. I was able to do that. Prior to my hip replacements, I had just picked up the game of golf. I had just started to learn a little bit. And I was just a few months in when I started developing the hip pain, which led me to the first and second surgeries. And so I knew immediately that I loved this game. I, of course, needed a lot of work because it's not an easy game to learn. And so I really missed the fact that I wasn't able to do that. After I got my rehab done, after the first one, I was able to start playing again. Then came the second one, and after that rehab, I was able to start playing again. And so, gotten a little bit better. Of course, I still need a lot of work, and I'm still fairly new. And my husband will tell you that although he drives the cart most of the time in between all the holes, I'm the one who walks just about the whole course. So I really, really love it. I really love the fact that I'm able to do it, and I'm able to do it pain-free, and I get a wonderful amount of exercise and lose a lot of golf balls, but have a lot of fun during the day and really enjoy it. On a recent family vacation, I had a birthday during our vacation, and my kids thought that it would be a great idea to give me parasailing tickets. So my husband and I went parasailing at Hilton Head, something that I've always wanted to do. It was wonderful. It was a lot of fun. I didn't have any problems whatsoever in being able to do it. But I had wanted to do that for a couple of years, and honestly, that's not anything I would have ever considered doing with the amount of pain I had been in with my hips. But since I'm pain-free and I'm able to participate and do things like that again, that was a lot of fun. My family physician is the first person who diagnosed my hip problem, and that set the chain of events to come down to see Dr. Burnikel and my hip replacement. During the time I was having my problems with my hip, my family doctor's wife was also having problems with her hip. And so after I had my surgery and he was able to see how quickly I recovered and how well I did, he wanted the information, all the information about Dr. Burnikel. And he actually scheduled an appointment and drove his wife down here as well. And she was evaluated for hip surgery with Dr. Burnikel too. I would like to thank Dr. Burnikel and Steadman Hawkins and Patewood Memorial for giving me such success with my hip replacements. It's basically given my life back to me. As we've discussed, I was so very sedentary, and now I'm back up and motivated to do all the things that I was doing prior to either one of my hip replacements. There's not a lot that I don't do now that I was doing then. So I can't thank everyone enough for the success that I've had in these joint replacements and how good I feel and the fact that I have my life back.